Good morning, all. I'm Dr. Aruna Murlidhar, and I'm connecting you from my home. As per our Honorable Prime Minister Narendra Modi ji's directive, the lockdown has been extended till the May 3rd, and hence the way I provide antenatal care to all the pregnant women has also changed. I'm currently available for video consultations to all my patients, and I am seeing pregnant women who are beyond 36 weeks on a regular basis. And the antenatal care itself has been modified to a certain extent to reduce the number of visits that you have to do to the hospital, and hence reduce the exposure to a possibility of developing COVID-19 infection. Hence now I'm providing antenatal care at the time that it's confirmed, at third month, fifth month, the seventh month, and then probably sometime in the eighth month, and then finally at ninth month onwards. There are certainly a lot of questions which need to be answered, in terms of pregnant women and the current COVID-19 pandemic. So I'll try and answer some of the frequently asked questions. The first question probably would be in relation to, are pregnant women more likely to develop COVID infection? So the current evidence that we have from the countries which have suffered so far, like China and Italy and America, is that certainly the pregnant women are already in a sort of immunodeficient sort of physiology, and hence they can be badly affected by some respiratory infections, and hence it's extremely important to take care and take the necessary precautions. This information is coming through, and WHO is processing it as we speak, and a lot of information will be out soon. But for now, it is definitely a good idea to take necessary precautions. So far, there hasn't been any major evidence that pregnant women are more likely to be infected. Yes, how do I protect myself? Now you have to protect yourself. And how do you protect myself? How does one protect oneself from the COVID virus? So definitely washing hands frequently with either soap and water or an alcohol-based rub. Keeping space between you and your others, especially now that you're at home, lockdown, even when your vegetable wala or milk wala comes, try to keep a good amount of distance. Ask them to keep them at a certain place or a basket in front of your doorstep, so that you do not get those vegetables straight in, or don't handle the vegetables straight away, right? You might want to choose your vegetables near the cart. Probably not a good idea for you yourself to go. Somebody else in the house can choose the vegetables for you. So there should be one person appointed for contact with the outsiders rather than everybody in the family, right? And as soon as the vegetables come in, they need to be doused with, basically soaked in soapy water, so that any possibility of transmission can be avoided. And similarly, the hands and whatever has come in contact has to be washed. Probably a good idea washing your face as well immediately after any outside visit. Pregnant women, certainly please avoid doing the vegetable shopping or the grocery shopping yourself, right? Of course, the other important thing is to keep a distance of at least a meter. They say 6 feet, which may not be possible every time, but the longer the distance, the lesser the possibility of the droplets reaching you. And also avoiding touching your eyes, nose and mouth too often, right? Definitely wearing a mask yourself, and probably lending a mask out to all the vegetable sellers if they do not have one already would be a good idea, because it's a two-way protection. You're not passing on the droplets, and nor are the droplets falling on you, and similarly for them as well, right? And of course, practicing good respiratory hygiene. And what I mean by respiratory hygiene is to have a tissue or a hand, kerchief with you if you cough or sneeze, so that you sneeze into it. And if it's a disposable one, you immediately put it into the dustbin with a lid on it. and you cough and sneeze, if you do not have anything, into your elbow, because that's the least likely place that you will touch your hand or face with, or somebody else with, right? Certainly, if you have fever, cough, or cold, or dry cough, or difficulty in breathing, it is something that you will have to flag up, and you will be put across to fever clinics who are in the job of actually finding out who has the infection and who do not, and where they need to be directed to. Now, should all pregnant women be tested for COVID 19 infection? Testing protocols and eligibility vary very, very much, but in India, we are definitely not testing all the pregnant women. As I said, the guidelines are still developing. There are some home testing kits also being developed, and if there is any such thing, then of course you will get to know about it through various resources. However, WHO recommendations are that pregnant women with symptoms of COVID should be prioritized for testing. So yes, pregnant women will come first in terms of testing if they need to be tested because of the symptoms. Now, can the COVID be passed on to the unborn child? Now, we still do not know if a pregnant woman with COVID 19 can pass the virus to her fetus or baby during the pregnancy or delivery. So far, the virus has not been found in any samples of amniotic fluid or breast milk, for that matter. What care should be available during pregnancy and childhood? So, all pregnant women, including those with confirmed or suspected COVID infections, have the right to health and quality care like before, and they are, during, before, during childbirth, and even after childbirth. So yes, that is a very important right that you have, and this includes antenatal, newborn, postnatal, intrapartum, that is in the time of the delivery, and mental health care as well. So a safe and positive childbirth experience is what I wish to give, and that is to be treated with respect and dignity, a clear communication by the maternity staff, appropriate pain relief strategies, and mobility in the labor room and birth positions during labor. Right? Do pregnant women with confirmed and suspected COVID need to give birth by cesarean section? Is that required? No, absolutely not. The WHO advises that cesarean section should only be performed when medically justified. The mode of birth should be individualized, but at the same time, we do not obviously want the lady to be in labor for too long, considering the fact that there may be many medical personnel coming in contact with her. So yes, there may be slight variations in the way the labor is, allowed to progress. So that is again an individual decision that I have to make at the time. And can women with COVID 19 breastfeed? Of course, certainly, as long as you're practicing the respiratory hygiene during feeding, wearing a mask. Please go ahead. You need to wash your hands before and after you touch the baby, and routinely clean and disinfect surfaces that the lady has touched. Can I touch and hold my newborn baby if I have COVID 19? Of course. Close contact and early exclusive breastfeeding helps the baby in basically in passing on the antibodies that the lady herself has developed, and also the breastfeeding safety, holding the skin, baby skin to skin, and sharing the room with the baby. All that is possible as long as you use the mask, respiratory hygiene, and washing your hands before and after touching. So, I have COVID 19 and I'm too unwell to breastfeed my baby directly. What can I do? If you're too unwell to breastfeed your baby, definitely, we will have to provide the breast milk in the safest possible way. So, whether it's a matter of expressing and, pumping and then giving the milk to the baby, or baby may have to be supported with formula feeds depending on the condition of the mother. These are the various questions that one may have in terms of the COVID. But as I said, prevention is better than cure. And certainly in this case, prevention is definitely better than cure, because there is no cure as such available. And hence, it is important that we take our own necessary precautions. Also, please be aware that most of the people who have COVID 19 infection have very mild symptoms, and many times they recover completely. The question of becoming worse is only in certain proportion of cases, and obviously mortality or death is in much lesser number of cases. So please be reassured that yes, it is a pandemic, but as long as we take the right precautions and do the all the necessary guidelines which have been put forth in all sorts of media by the government, we will sail through successfully. And hope you all have a wonderful pregnancy, happy pregnancy, and happy motherhood. Thank you.